The coronavirus hysteria is fake.
Dr. Drew, how are you today?
What's going on?
Beautiful day out. How are you doing?
It really is. Beautiful day in New York.
I think there's so much going on with this coronavirus. What is the difference? Fact and fiction? What is real?
Everything that's being reported is real.
Okay.
Just listen to the CDC and Anthony Fauci and behave accordingly. And remember, we have 24 million flu cases, 280,000 people hospitalized, 16,000 dead from the flu. Every report on corona should end with, get your flu shot. Get your flu shot. Way more likely to kill you than corona. Now, corona's a serious thing for people that are in infectious disease and epidemiology. They need to put this thing to rest. They will. And all we have to do is follow their directions. But the panic that the press is creating is unconscionable. It's interrupting the supply line. Now my elderly patients are having trouble getting their medication because the supply line is interrupted. So the panic is having real results. So settle down, everybody. Follow the CDC's recommendations and let's get on with things. Get your flu shot. Get your flu shot.
I understand you just got off the phone with the governor of New York, Andrew Cuomo. Can you tell us about that conversation? The governor had been wanting to deploy Army Corps of Engineers. Will you?
Sure. Let me say one thing first of all. I wanted to assure all of your viewers that the United States military remains ready and capable of defending the American people, protecting the nation, and safeguarding our interests.
Changing in Australia as it is changing all around the world, life is going to continue to change as we deal with the global coronavirus. This is a once-in-a-100-year type event. We haven't seen this sort of thing in Australia since the end of the First World War.
One district in Hubei province, where there are more than 500 confirmed cases, has started wartime population control measures. That means all buildings are closed. Everyone must stay in their homes.
There are long-established plans by which the police will, obviously they will keep the public safe, but they will prioritise those things that they have to do, and the army is of course always ready to backfill as and when.
This is another front line as far as I'm concerned at the moment. We are battling a hideous disease.
South Korean President Moon Jae-in declared war against the coronavirus Tuesday.
Now from Kerala, a special ground report on how the 3 coronavirus patients from Kerala spread the infection. The authorities now have traced and tracked every single person who came in contact with them and used every possible technology to contain the impact.
Working as a war room, this team is now collating the entire surveillance data into live geotag maps with each of the primary and secondary contacts traced, marked and identified on this map.
Are we on the brink of a financial crisis?
Well, I think let's step back and think about what we have here. Number one, this is a healthcare crisis and a humanitarian crisis, and we can't forget that we have to take care of people and handle that first. And by the way, that's the answer to the larger question. And I think I'd think about 3 things. This is a war. We're in a war to contain this virus.
Let's get stuck into this, guys. This is arguably the biggest story of our generation. Wartime push to produce key goods. That's the headline. Companies are being asked to make a wartime shift to produce much-needed medical supplies as the Morrison government prepares a second stimulus package, and economists warn the next budget could be plunged into a $100 billion deficit. I'm going to say that again, a $100 billion deficit.
UN Secretary General Antonio Guterres says it's time to declare war on the new coronavirus. In a video message to the world, Antonio Guterres said preventing the further spread of the virus was a shared responsibility for all of people.
The spread of the virus will peak, our economies will recover, and until then we must act together to slow the spread of the virus and look after each other. This is a time for prudence, not panic, science, not stigma, facts, not fear. Even though the situation has been classified as a pandemic, It is one we can control. We can slow down transmissions, prevent infections, and save lives. But that will take unprecedented personal, national, and international action. We must declare war on this virus. And that means countries have a responsibility to gear up, step up, and scale up by implementing effective containment strategies, by activating and enhancing emergency response systems, by dramatically increasing testing capacity and care for patients, by readying hospitals, ensuring they have the space, supplies, and needed personnel, and by developing life-saving medical interventions. And all of us have a responsibility too, to follow medical advice and take simple, practical steps recommended by health authorities. Dear friends, a pandemic drives home the essential interconnectedness of our human family. Preventing the further spread of COVID-19 is a shared responsibility for us all. The United Nations, including the World Health Organization, is fully mobilized. As part of our human family, we are working 24/7 with governments, providing international guidance, helping the world take on this threat. We stand in full solidarity with you. We are in this together, and we will get through this together.
I think it's similar to being at war, where hospitals are not enough, doctors are not enough. In Bergamo, there are about 70 family doctors that are quarantined. Imagine the impact of having the doctors unable to work because they are sick themselves. And if they work, they spread the disease, and it becomes a vicious circle that it's almost impossible to stop.
Obviously, you are a veteran, to say the least, of markets and specifically credit markets and dealing with those credit markets. When you look at financial conditions as they stand right now, what type of effect are you seeing on your business, if at all?
I would say things are better than you're reporting.
Hello, everybody, and thank you for tuning in to the weekly report. The coronavirus hoax. Governments love crises because when the people are fearful, they are more willing to give up freedoms for promises that the government will take care of them. After 9/11, for example, Americans accepted the near total destruction of their civil liberties in the Patriot Act's hollow promises of security. It is ironic to see the same Democrats who tried to impeach President Trump last month for abuse of power, demanding that the administration grab more power and authority in the name of fighting a virus that thus far has killed less than 100 Americans. Declaring a pandemic emergency on Friday, President Trump now claims the power to quarantine individuals suspected of being infected by the virus, and as Politico writes, stop and seize any plane, train, or automobile to stymie the spread of contagious disease. He can even call out the military to cordon off a U.S. city or state. State and local authoritarians love panic as well. The mayor of Champaign, Illinois, signed an executive order declaring the power to ban the sale of guns and alcohol and cut off gas, water, or electricity to any citizen. The governor of Ohio just essentially closed his entire state. The chief fearmonger of the Trump administration is, without a doubt, Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases at the National Institute of Health. Fauci is all over the media, serving up outright falsehoods to stir up even more panic. He testified to Congress that the death rate for the coronavirus is 10 times that of the seasonal flu, a claim without any scientific basis. On Face the Nation, Fauci did his best to further damage an already tanking economy by stating, right now, personally, myself, I wouldn't go to a restaurant. He has pushed for closing the entire country down for 14 days. Over what? A virus that has thus far killed just over 5,000 worldwide and less than 100 in the United States. By contrast, tuberculosis, an old disease not much discussed these days, nearly killed 1.6 million people in 2017. Where's the panic over this? If anything, what people like Fauci and others fearmongers are demanding will likely make the disease worse. The martial law they dream about will leave people hunkered down inside their homes instead of going outdoors or to the beach where the sunshine and fresh air would help boost immunity. The panic produced by these fearmongers is likely helping spread the disease as massive crowds rush into Walmart and Costco for that last roll of toilet paper. The madness over the coronavirus is not limited to politicians and the medical community. The head of the neoconservative Atlantic Council wrote an editorial this week urging NATO to pass an Article 5 declaration of war against the virus. Are they going to send the tanks and drones to wipe out these microscopic enemies? People should ask themselves whether the coronavirus pandemic could be a big hoax, with the actual danger of the disease massively exaggerated by those who seek to profit financially or politically from the ensuing panic. That is not to say the disease is harmless. Without question, people will die from coronavirus. Those in vulnerable categories should take precautions to limit their risk of exposure. But we have seen this movie before. Government overhypes a threat as an excuse to grab more of our freedoms. When the threat is over, however, they never give us our freedoms back. Thanks for listening.
아니 그러니까 이걸 좀 빼달라 이거지. 여기다 차를 세우게.
Good evening, and it's great to have you with us here on a Thursday night. And it was another day of fast-moving developments in this coronavirus emergency, and we will carefully get through it all right here with you tonight. We're going to begin with the states of emergency across this country, and now here in New York City, a state of emergency declared as well. Tonight, more than 1,300 people sickened in the U.S. At least 39 have died in this country. At least 45 states now and the District of Columbia reporting cases. Additional school districts shutting down today. Now 4.9 million school children across the country at home. That first containment zone now in effect. The National Guard on the scene in New Rochelle, New York, just outside the city. And in New York, a ban on crowds of 500 or more, Broadway dark, concert halls and museums set to close. And that state of emergency here in New York City, the mayor reporting a major jump in cases today, 95 confirmed cases, saying there could be 1,000 in just a week.
Sta scoppiando la guerra, guardate cosa c'è qua, sta intervenendo l'esercito, chiudetevi a casa e non uscite.
So Iran has, the last count that I saw, which was I think yesterday, they've had about 429 deaths and over 10,000 people infected. And they've now asked the International Monetary Fund for $5 billion in emergency funding. And they're saying that they haven't really placed blame on exactly who they think unleashed this virus on them, but they do feel like they had this unleashed on them, that this is not something that naturally would have occurred in Iran. And let's go ahead and take a look at a map to see what they're talking about, because it does look a little bit suspicious. When you look at the map, look at Iran here with 10,075 cases. Now, this was from yesterday, but look at the surrounding areas. Look at Afghanistan, 7 cases in Afghanistan. Look at over here in Iraq, 71 cases in Iraq. Look at the Arabian Peninsula. I mean, you've got 80, 74, 18, 45 in Saudi Arabia. You know, you've got all of these small numbers surrounding Iran, but you've got 10,075 cases in Iran. And if you look at the countries in between Iran and China, look at here again, if you look at the map, you've got India with only 73. I mean, India is a densely populated country, and they only have 73, yet Iran has 10,075. Now, some people say, well, the reason why Iran got it was because China and Iran have a strong trade partnership. Well, China has a strong trade partnership with many countries around the world, and yet those countries are not seeing thousands and thousands of coronavirus cases.